Humidification is important because when you have a tracheotomy, which is a hole in the neck approximately here, you have bypassed the natural humidification mechanism of the body, which is the nose, mouth, and throat. So that by putting humidification through the trach, we restore things to as close to normal as possible.
We frequently see patients coming from an acute care hospital that have in their reports required numerous methods of pulmonary toilet, meaning either several episodes of suctioning, several times of undergoing bronchoscopy for removing secretions, and therefore not always getting the amount of humidification needed inside their airways and to prevent problems such as this. So getting humidified oxygen, getting humidified air really helps with what we call pulmonary toilet, clearance of secretions, preventing lobar collapse, lung collapse, but also just in the minimum of lessening irritation of the nares, the mucosa of the nose and the upper airway. It is so much more comfortable for the patient and tolerated well.